So here is section 4E. It's the double sequential external defibrillation adult. If you've never done this before, it might seem kind of crazy, but it works really well. We've been doing this for several years now. Just if you have never done it, make sure you read through this after you watch this video and make sure you fully understand it. So the indications for these, again, VFib, pulseless VTAC, contraindication, spontaneous pulse, or any cardiac rhythm except VFib or pulseless VTAC. So the technique behind this is if you have, sorry, allergies are killing me. If 2 LifePak 12s or 15 monitors are available, you'll press the second one on. I'll read these techniques real quick and then I'll just kind of walk you through what we're doing. So connect the therapy electrodes to therapy cable, confirm cable connection to monitor, prepare the patient's skin, as we talked about on the last protocol, but not overlapping the anterior pad of the first set of therapy electrodes. So you never want to overlap them for any reason. Proceed to charge each defibrillator to 360 once fully charged. Have either one paramedic discharge both defibrillations or using 2 paramedics using the 3-2-1 verbal countdown. Discharge of the defibrillators sequentially using a very specific count of 1001 between the discharge of defibrillator 1 and discharge of defibrillator 2. Failure to allow 1 second pause between sequential defibrillations can irreversibly harm a defibrillator, rendering it permanently inoperable. Number 5, throughout the use of double sequential external defibrillation, follow all standard safety measures as routine defibrillation as outlined in Protocol 4D. Clinical pearls do not continue to provide chest compressions while you're defibrillating, as we talked about several times before. So just real quick, real simple. If you are going to use dual sequential, which we will on patients, on any cardiac arrest patient, adult patient. So if the patient is greater than 100 kilos, then we will start with 360. How this works is you will use one monitor, the first defibrillation at 360. After that, if you have that second monitor, you will attach the second pads. Remember, the first pads are going to go anterior, posterior. The second one's going to go like we've done before. If you look on the picture, the pink pads right there. So the blue pads were the pads that were placed first. The pink pads were placed second. And then that second defibrillation after 360, you will either have 2 paramedics in charge of each monitor or 1 paramedic in charge of both monitors. If you're going with 1 paramedic in charge of both monitors, you'll charge both monitors up to the same setting. You will, at that rhythm analysis mark, if it's pulseless VTAC or VFib, you will defibrillate the first monitor and then you will defibrillate the second monitor. If you have 2 paramedics, which is how we typically do it, I feel like it's probably the safest way. You're going to use that 3-2-1 verbal countdown. So me as paramedic 1 would say defibrillate, 3, 2, 1, and then the next paramedic would defibrillate their monitor, and then you would immediately resume chest compressions once again. Pretty simple. Just don't forget to do it. And in the case that they're not over, if they're less than 200 or 100 kilos, and you're going from 200 to 300 to 360, you're still going to do that. You're going to go 200, 300, 360, and then after 360, you will start your dual sequential. So again, just to simplify it so no one is confused, under 100 kilograms, you will defibrillate at 200, 300, 360, dual sequential, and then you'll do dual sequential from there on out. If they are over 100 kilograms, you will start at 360, and then your second defibrillation will be dual sequential. And then everything after that will continue to be dual sequential.